NCLEX Model Question Paper for Nurses, 2026. Question 1. Which of the following is a criteria that defines nursing as a profession? A. An undefined body of knowledge. B. The dependence on the medical profession. C. An ability to diagnose medical problems. D. The profession that places patients in the center of care. The correct answer is a profession that places patients in the center of care. Nursing is recognized as a profession that places patients in the center of care. Question 2. Amy Jones, a high school senior, wants to become a nurse midwife. What nursing degree will she need to attain this goal? A. Licensed practical nurse. B. Master's degree. C. Baccalaureate degree. D. Associate degree. The correct answer is master's degree. A master's degree is typically required for advanced practice roles like nurse midwifery. Question 3. What is the primary purpose of standards of nursing practice? A. To establish nursing as a profession and a discipline. B. To provide a method by which nurses perform skills rapidly. C. To help ensure knowledgeable, safe, comprehensive nursing care. D. To enable nurses to have a voice in healthcare policy. The correct answer is to help ensure knowledgeable, safe, comprehensive nursing care. Standards of practice ensure safe and comprehensive care. Question 4. Which age group in the population is expanding most rapidly, resulting in changes in the delivery of healthcare? A. Older adults. B. Young adults. C. Newborns. D. School-aged children. The correct answer is older adults. The older adult population is the fastest growing demographic. Question 5. What nursing activity would meet the broad nursing aim of facilitating coping with disability and death? A. Conducting a blood pressure screening program. B. Performing a physical assessment on a patient. C. Administering intravenous fluids and oral medication. D. Referring patients and families to community support groups. The correct answer is referring patients and families to community support groups. Referrals to support groups assist with coping mechanisms. Question 6. A competent adult patient is scheduled for surgery. Who signs the information consent form to allow for the surgery? A. The spouse. B. The physician. C. The patient. D. The nurse. The correct answer is the patient. A competent adult patient must sign their own informed consent. Question 7. A nurse has taken a telephone order from a physician for an emergency medication. The dose of the medication is abnormally high. What should the nurse do next? A. Administer the medication based on the order. B. Question the order for the medication. C. Refuse to administer the medication. D. Document concerns about the order. The correct answer is question the order for the medication. Nurses must question orders that appear unsafe or incorrect. Question 8. A patient gets out of bed following hip surgery and falls and re-injures her hip. The nurse caring for her knows that it is her duty to make sure an incident report is filed. Which of the following statements accurate describe the correct procedure for filing an incident report? A. The physician in charge should fill out the report. B. The names of the staff involved need not to be included. C. The report will be used for disciplinary action against the staff. D. The report should contain all the facts related to the incident. The correct answer is the report should contain all the facts related to the incident. Incident reports must contain all factual details regarding the event. Question 9. The family of a patient in a burn unit asks the nurse for information. The nurse sits with the family and discusses their concerns. What type of communication is this? A. A small group. B. Interpersonal. C. Organization. D. Intrapersonal. The correct answer is small group. Communication involving a small number of people, nurse and family, is small group communication. Question 10. A nurse is sitting near a patient while conducting a health history. The patient keeps edging away from the nurse. What might this mean in terms of personal space? A. The nurse is too far away from the patient. B. The nurse is in the patient's personal space. C. The patient does not like the nurse. D. The patient has concerns about the questions. The correct answer is the nurse is in the patient's personal space. Edging away suggests the nurse has intruded into the patient's personal space. Question 11. Which of the following is an example of a closed-ended question or statement? A. Did you take those drugs? B. How did that medication make you feel? C. Tell me about things that relieve your pain. D. Describe the type of pain you have. The correct answer is did you take those drugs? Questions that can be answered with a yes or no are closed-ended. Question 12. A nurse tells a patient, "Why won't you get out of bed? Are you always this lazy?" This is an example of which of the following barriers to communication? A. Using leading questions. B. Using probing questions. C. Using judgmental language. D. Using comments that give advice. The correct answer is using judgmental language. Calling a patient lazy is judgmental and blocks communication. Question 13. Which of the following is an essential component in the definition of patient learning? A. Decreases stress. B. Can be evaluated. C. Cannot be confirmed. D. Increases self-worth. The correct answer is can be evaluated. Learning must be measurable and evaluable. Question 14. A patient tells the nurse that he does not want to answer any questions while his wife is present at the bedside. By respecting and supporting the patient's right, what is the nurse demonstrating? A. Justice. B. Altruism. C. Advocacy. D. Confidentiality. The correct answer is confidentiality. Protecting the patient's privacy is an act of confidentiality. Question 15. While at lunch, a nurse heard other nurses at a nearby table talking about a patient they did not like. When they asked him what he thought, he politely refused to join in the conversation. What value was the nurse demonstrating? A. Basic respect for human dignity. B. Men do not gossip with women. C. A low value on collegiality and friendship. D. The importance of food in meeting a basic human need. The correct answer is basic respect for human dignity. Refusing to gossip demonstrates respect for human dignity. Question 16. Using Erickson's theory, which of the following activities would the nurse use to provide a sense of fulfillment and purpose in later adulthood? A. Making a commitment to others. B. Trying on new and different roles. C. Reminiscing about life events. D. Becoming involved within the community. The correct answer is reminiscing about life events. Reminiscence helps achieve ego integrity in later adulthood. Question 17. Which of the following is an important role for the nurse when incorporating principles and theories of growth and development? A. Initiate interventions to meet specific outcomes of care. B. Provide physical care to meet needs of young children. C. Initiate activities that involve passive interactions with others. D. Provide developmentally challenging environments and experiences. The correct answer is provide developmentally challenging environments and experiences. Providing developmentally appropriate challenges promotes growth. Question 18. While conducting a health assessment with an older adult, the nurse notices it takes the person longer to answer the questions than with younger patients. What should the nurse do? A. Realize that the patient has some dementia. B. Slow the pace and allow extra time for answers. C. Ask a family member to answer the questions. D. Stop asking questions so as not to confuse the patient. The correct answer is slow the pace and allow extra time for answers. Older adults may require more time to process and respond to questions. Question 19. A female client is told that she needs a pelvic examination and she replies absolutely not. Which response by the nurse would be appropriate? A. Explain the importance of the exam but respect her wishes and omit the test. B. Tell the client that this is the only way to check for cancer. C. Ask the client if she would like another practitioner to perform the exam. D. Proceed with the exam and document the client's protests in the health record. The correct answer is explain the importance of the exam but respect her wishes and omit the test. Patients have the right to refuse treatment. The nurse should explain the importance but respect the refusal. Question 20. The nurse is to collect a throat culture from a client who has signs and symptoms of a respiratory infection, including a frequent and productive cough. The nurse demonstrates the best adherence to standard precautions by using which of the following pieces of equipment? A. Eye goggles. B. A face mask. C. Cover gown. D. Face shield. The correct answer is face mask. A face mask protects the nurse from droplet transmission during the procedure. Question 21. While performing the initial assessment of a client, the client tells the nurse that this is his first hospitalization and that he has no history of surgeries. The nurse should document which of the following? A. Client denies prior hospitalizations and surgery. B. Client has not been hospitalized nor has he had any surgery. C. Client has answered no to previous hospitalizations and surgery. D. Negative for past hospitalizations. The correct answer is client denies prior hospitalizations and surgery. Documentation should be concise and clearly state the client's report. Question 22. A nurse is analyzing data of a client who has been admitted for heart failure. The nurse has determined that the clue clusters meet the defining characteristics of a specific diagnosis. Which of the following would the nurse do next? A. Explain the client's problems to the client and the family. B. Verify the findings with the client and other healthcare professionals. C. Validate the nursing diagnosis with the physician. D. Work with the client to begin planning interventions. The correct answer is work with the client to begin planning interventions. After establishing the diagnosis, the next step is planning interventions. Question 23. The client was diagnosed with diabetes 3 years ago, but has failed to integrate regular blood glucose monitoring or dietary modifications into his lifestyle. He has been admitted to the hospital for treatment of acute renal failure secondary to diabetic neuropathy, an event that has prompted the client to reassess his values. Which of the following actions most clearly demonstrates that this client is engaging in the step of pricing his valuing process? A. The client is now able to explain how his choices have contributed to his renal failure. B. The client states that he will now begin to check his blood glucose before each meal and at bedtime. C. The client expresses remorse at his failure to make lifestyle changes has adversely affected his health. D. The client expresses pride that he now has the knowledge and skills to take control of his diabetes management. The correct answer is the client expresses pride that he now has the knowledge and skills to take control of his diabetes management. Pricing involves cherishing and being happy with the choice/value. Question 24. A group of nurse researchers has proposed a study to examine the efficacy of a new wound care product. Which of the following aspects of the methodology demonstrates that the nurses are attempting to maintain the ethical principle of non-maleficence? A. The nurses have organized the study in such a way that the foreseeable risks and benefits are distributed as fairly as possible. B. The nurses have completed a literature review that suggests the new treatment may result in decreased wound healing time. C. The nurses are taking every reasonable measure to ensure that no participants experience impaired wound healing as a result of the study intervention. D. The nurses have given multiple opportunities for potential participants to ask questions, and have been following the informed consent process systematically. The correct answer is the nurses are taking every reasonable measure to ensure that no participants experience impaired wound healing as a result of the study intervention. Non-maleficence means do no harm. Question 25. A client with a diagnosis of colorectal cancer has been presented with her treatment options, but wishes to defer any decisions to her uncle, who acts in the role of a family patriarch within the client's culture. By which of the following is the client's right to self-determination best protected? A. Teaching the client about her right to autonomy. B. Respecting the client's desire to have the uncle make choices on her behalf. C. Revisiting the decision when the uncle is not present at the bedside. D. Holding a family meeting and encouraging the client to speak on her own behalf. The correct answer is respecting the client's desire to have the uncle make choices on her behalf. Respecting the client's cultural decision-making structure supports their self-determination. Question 26. A nurse provides client care within a philosophy of ethical decision-making and professional expectations. What is the nurse using as a framework for practice? A. Code of ethics. B. Standards of care. C. Definition of nursing. D. A values clarification. The correct answer is Code of Ethics. The Code of Ethics provides the framework for ethical decision-making. Question 27. Which of the following statements accurately describes recommended guidelines for overcoming resistance for change? Select all that apply. A. Explain the proposed changes only to the managers. B. Whenever possible, use technical language. C. List the advantages of the proposed change for members of the group. D. Avoid relating the change to the group's existing beliefs. E. If possible, introduce change gradually. The correct answer is list the advantages of the proposed change for members of the group. Listing advantages and introducing change gradually helps overcome resistance. Question 28. The nursing student is working to improve his time management. Which of the following would assist the nursing student in accomplishing his goal? Select all that apply. A. Identify priorities for the day. B. Evaluate time management at the end of the day. C. Establish a reasonable timeline. D. A plan to arrive right at start of shift. The correct answer is identify priorities for the day, and evaluate time management at the end of the day, and establish a reasonable timeline. Prioritizing, evaluating, and setting timelines are key time management strategies. Question 29. A nurse is considering the delegation of administering medications to an unskilled assistant. What is the first question the nurse must ask herself before doing so? A. Has the assistant been trained to perform this task? B. Is the delegated task permitted by law? C. Have I evaluated the client's response to this task? D. Is appropriate supervision available? The correct answer is the delegated task permitted by law? Legal permission is the absolute first prerequisite for delegation. Question 30. In general, how do most people view change? A. By how it affects the cohesiveness of the group. B. By how much it will cost in time and resources. C. By how it will affect others on the staff. D. By how they are affected personally. The correct answer is by how they are affected personally. Most individuals assess change based on personal impact. Question 31. Which of the following statements accurately describes factors that may affect an individual's growth and development? Select all that apply. A. Physical characteristics are inherited. B. Fetal development can be altered by maternal age/nutrition. C. Abuse is more prevalent in teenagers who have poor family relationships. D. Infants who are malnourished develop fewer brain cells. The correct answer is physical characteristics are inherited in fetal development can be altered by maternal age/nutrition and abuse is more prevalent in teenagers who have poor family relationships and infants who are malnourished develop fewer brain cells. Genetics, prenatal environment, social factors, and nutrition all affect development. Question 32. The emergency department nurse is caring for an infant aged 2 months who was brought in by a hired caregiver. The infant is underweight and looks uncared for. If this situation is not remedied, what will this infant have difficulty achieving, according to Erickson's developmental theory? A. Autonomy. B. A trust. C. Identity. D. Initiative. The correct answer is trust. Infants, 0-18M, deal with trust versus mistrust. Question 33. According to Erickson, normal adolescent behavior includes trying on new roles and possibly even rebelling. What is the purpose of this behavior in adolescence? A. To gain autonomy. B. To avoid inferiority. C. To establish a sense of security. D. To establish a sense of identity. The correct answer is to establish a sense of identity. Adolescents deal with identity versus role confusion. Question 34. A child gains weight and becomes taller each year. What is this process called? A. Growth. B. Development. C. Progression. D. Orderly change. The correct answer is growth. Growth refers to physical changes in size. Question 35. The nurse is providing education on childhood safety. The nurse relates that the major causes of death in toddlers include which of the following? Select all that apply. A. Infections. B. Childhood diseases. C. Drowning. D. Motor vehicle crashes. E. Accidents. The correct answer is drowning and motor vehicle crashes. E. Accidents. Accidents like drowning and crashes are leading causes of death in toddlers. Question 36. The nurse is educating the mother of an infant age 4 months on safety concepts in child rearing. Which of the following statements by the mother suggests that she may require some repetition and reinforcement of the information? A. I must keep small objects out of the baby's reach. B. The baby will sleep in her crib, not with me and my husband. C. I must keep appointments for the baby's immunizations. D. The baby can sleep on her stomach during naps. The correct answer is the baby can sleep on her stomach during naps. Infants should sleep on their backs to prevent SIDS. Question 37. A student nurse is assigned to care for a preschool kid who is scheduled for surgery. How can the student decrease the child's fears about the surgery? A. Explain that nothing is going to hurt and that it will soon be over. B. Be honest about the pain and use words the child can understand. C. Ask the child's parents to pretend that nothing is going to be done. D. Ignore the child's fears and focus on teaching the parents. The correct answer is be honest about the pain and use words the child can understand. Honesty using age-appropriate language is essential for preschoolers. Question 38. A nurse who provides care in a long-term care facility recognizes the need to promote health rather than solely treating illness. Which measures should the nurse encourage? Select all that apply. A. Encourage frequent naps. B. Encourage diet supplements. C. Conduct activities at a slower pace and allow residents time to respond. D. Encourage residents to engage in the present. E. Promote self-care and only assist residents when it is necessary. The correct answer is conduct activities at a slower pace and allow residents time to respond. Pacing activities and promoting self-care maintain independence. Question 39. While caring for an older adult male, the nurse observes that his skin is dry and wrinkled, his hair is gray, and he needs glasses to read. Based on these observations, what would the nurse conclude? A. These are normal physiologic changes of aging. B. The observations are not typically found in older males. C. These are abnormal and must be reported. D. Extra education will be necessary to prevent complications. The correct answer is these are normal physiologic changes of aging. These are expected changes in the aging process. Question 40. Which of the following statements is true for nursing care of older adults? A. Most older adults are unable to care for themselves independently. B. Most older adults are functional, benefiting from health-oriented interventions. C. Fewer older adults will require nursing care during the 21st century. D. Interventions for older adults are no different from those for young adults. The correct answer is most older adults are functional, benefiting from health-oriented interventions. The majority of older adults remain functional and benefit from health promotion. Question 41. Which of the following statements accurately describes how risk factors may increase a person's chances for illness or injury? Select all that apply. A. Risk factors are unrelated to the person or event. B. All risk factors are modifiable. C. An increase in risk factors increases the possibility of illness. D. An increase in risk factors increases the possibility of illness. The correct answer is an increase in risk factors increases the possibility of illness. And an increase in risk factors increases the possibility of illness. Accumulation of risk factors increases illness probability. Question 42. Which of the following models of health promotion and illness prevention was developed to illustrate how people interact with their environment as they pursue health? A. The health belief model. B. The health illness continuum. C. The health promotion model. D. The agent host environment model. The correct answer is the health promotion model. Pender's health promotion model focuses on interaction with the environment. Question 43. Which of the following statements illustrates the effect of the sociocultural dimension on health and illness? A. My mother has sickle cell anemia, and so do I. B. I used biofeedback to lower my blood pressure. C. Why shouldn't I drink and drive? Everyone else does. D. I know I have heart problems, so I have changed my diet. The correct answer is why shouldn't I drink and drive? Everyone else does. Peer pressure and social norms are sociocultural factors. Question 44. A 12-year-old African-American client has experienced significant blood loss. The family is present. How should the nurse direct questions in teaching about the client's condition? A. Assess who is the dominant member of the family and then address that person. B. Address the mother, as African-American families are commonly matriarchal. C. Ask the child's father what should be done, but make eye contact with everyone. D. Direct questions to the family collectively to avoid presuming who is dominant. The correct answer is assess who is the dominant member of the family and then address that person. Cultural competence involves assessing family dynamics rather than assuming. Question 45. A nurse is caring for an adolescent who is in the hospital for a long-term illness. Which of the following interventions would promote the development of the hospitalized adolescent? A. Provide the teen structure in daily activities. B. Encourage the family to have fun game night activities once a week. C. Arrange for a tutor to cover missed schoolwork. D. Connect the teen to their peer group as much as possible. The correct answer is connect the teen to their peer group as much as possible. Peer connection is crucial for adolescent development. Question 46. The nurse is performing an assessment on a client with a history of a dysfunctional family. What findings should the nurse anticipate? Select all that apply. A. Unhealthy personal boundaries. B. Supportive parents. C. Abuse and neglect. D. Direction and attention. The correct answer is unhealthy personal boundaries and abuse and neglect. Dysfunctional families often exhibit poor boundaries and abuse/neglect. Question 47. A nurse is conducting an intake assessment and wants to determine a client's ethnicity. Which of the following is the best way for the nurse to conduct this assessment? A. Observe the practices of the client over the shift. B. Task whether the client identifies with a particular culture or ethnic group. C. Task other nurses for their opinion of the client's ethnicity. D. Observe the client for specific speech patterns or clues to ethnicity. The correct answer is ask whether the client identifies with a particular culture or ethnic group. Directly asking the client is the most accurate method. Question 48. According to Erikson's theory of development, chronic illness will have the greatest impact on which client? A. 1-year-old. B. 3-year-old. C. A 14-year-old. D. A 41-year-old. The correct answer is 14-year-old. Adolescents, identity versus role confusion, struggle most with being different due to illness. Question 49. A healthy client is on a regular diet 24 hours postpartum. The client's mother asks the nurses if she can bring her daughter some special foods from home. The nurse responds, based on the understanding about which principle? A. Foods from home are generally discouraged on the postpartum unit. B. This is permissible as long as the foods are nutritious and high in iron. C. The client's healthcare provider, HCP, needs to give permission for the foods. D. The mother can bring the daughter any foods that she desires. The correct answer is the mother can bring the daughter any foods that she desires. Unless medically contraindicated, cultural food preferences should be supported. Question 50. A group of nurses has established a focus group and pilot study to examine the potential application of personal data assistants, PDAs, in bedside care. This study is a tangible application of A. Case management. B. A telemedicine. C. Nursing informatics. D. Information technology. The correct answer is nursing informatics. Nursing informatics integrates nursing science with information management. Question 51. A nurse who collected and organized data during a client history realizes that there is not enough information to plan interventions. Which of the following would be the best remedy to prevent this from happening in the future? A. The nurse should update the database. B. The nurse should modify the data collection tool. C. The nurse should practice interviewing strategies. D. The nurse should determine the specific purpose of data collection. The correct answer is the nurse should practice interviewing strategies. Improving interviewing skills ensures comprehensive data collection. Question 52. A nurse caring for a client admitted to the intensive care unit with a severe headache assesses the client's vital signs, pupils, and orientation every few minutes. The nurse is performing which type of assessment? A. The initial assessment. B. Focused assessment. C. Time-lapsed assessment. D. The emergency assessment. The correct answer is focused assessment. A focused assessment targets a specific problem, headache/neuro. Question 53. An unconscious patient is brought to the emergency department. Which of the following assessments should be implemented first? A. The client's airway should be assessed. B. The client's past medical history is assessed. C. The nurse should review the client's medications. D. The nurse should determine the reason for admission. The correct answer is the client's airway should be assessed. Airway is always the first priority, ABC. Question 54. Which of the following is a correct guideline to follow when composing a nursing diagnosis statement? A. Phrase the nursing diagnosis as a client need. B. Incorporate subjective and judgmental terminology. C. Place the etiology prior to the client problem. D. Place defining characteristics after the etiology and link them by the phrases evidenced by. The correct answer is place defining characteristics after the etiology and link them by the phrases evidenced by. Format, problem or/t etiology AEB characteristics. Question 55. A client with a new colostomy becomes hostile. The nurse documents noncompliance related to hostility. What mistake has the nurse made? A. Identifying a problem that cannot be changed. B. Presuming to know the factors contributing to the problem. C. Neglecting to identify potential complications related to the problem. D. Identifying a problem without corroborating evidence in the statement. The correct answer is presuming to know the factors contributing to the problem. The nurse presumed the cause, etiology, without verification. Question 56. Which of the following statements accurately describes the legal responsibility of the nurse making a diagnosis for a client? A. The nurse must decide if he or she is qualified to make a nursing diagnosis and will accept responsibility for treating it. B. The nurse may make a diagnosis, but the physician is responsible for making sure it is appropriate for the client. C. The healthcare facility directs the nursing diagnosis in order to receive payment for services performed. D. The nurse practitioner is responsible for making all nursing diagnoses. The correct answer is the nurse must decide if he or she is qualified to make a nursing diagnosis and will accept responsibility for treating it. Nurses are legally accountable for the diagnoses they identify and treat. Question 57. What is the primary purpose of the outcome identification and planning step of the nursing process? A. To collect and analyze data to establish a database. B. To interpret and analyze data so as to identify health problems. C. To write appropriate client-centered nursing diagnosis. D. To design a plan of care for and with the client. The correct answer is to design a plan of care for and with the client. Planning involves designing the care plan with the client. Question 58. A nurse is discharging a client from the hospital. When should discharge planning be initiated? A. At the time of discharge from an acute healthcare setting. B. Before admission to an acute healthcare setting. C. At the time of admission to an acute healthcare setting. D. When the client is at home after acute care. The correct answer is at the time of admission to an acute healthcare setting. Discharge planning begins upon admission. Question 59. Which of the following is a correctly written goal? Select all that apply. A. The client will identify 5 low-sodium foods by October 9th. B. The client will know the signs and symptoms of an infection. C. The client will rate pain as a 3 or less on a 10-point scale by 5 p.m. today. D. The client will understand the side effects of digoxin. E. The client will eat at least 75% of all meals by May 5th. The correct answer is the client will identify 5 low-sodium foods by October 9th. And the client will rate pain as a 3 or less on a 10-point scale by 5 p.m. today. Goals must be specific, measurable, achievable, relevant, and time-bound, SMART. Question 60. Which of the following principles should the nurse follow when delegating to the UAP? Select all that apply. A. Ensure that UAPs closely follow the nursing process. B. Audit the client documentation that UAPs record. C. Take frequent mini-reports from UAPs to ensure changes in client status are identified. D. Know what clinical cues the UAP should be alert for and why. E. Make frequent walking rounds to assess clients. The correct answer is take frequent mini-reports from UAPs to ensure changes in client status are identified, and know what clinical cues the UAP should be alert for and why. E. Make frequent walking rounds to assess clients. Supervision involves communication, guidance, and direct observation. Question 61. A nurse administers a medication for pain but forgets to document it in the client's medical record. Legally, what does this mean? A. Nothing, the nurse's honesty will not be questioned. B. The nurse can add the documentation after the client goes home. C. The physician will verify that the nurse carried out the order. D. In the eyes of the law, if it is not documented, it was not done. The correct answer is in the eyes of the law, if it is not documented, it was not done. Documentation is the legal proof of care provided. Question 62. Which of the following statements accurately describes a recommended guideline for implementation? Select all that apply. A. Act independently regardless of wishes. B. Before implementing any nursing action, reassess the client to determine whether the action is still needed. C. Assume the intervention is the best. D. Consult colleagues in the nursing and related literature to see if other approaches might be more successful. The correct answer is before implementing any nursing action, reassess the client to determine whether the action is still needed, and consult colleagues in the nursing and related literature to see if other approaches might be more successful. Reassessment and evidence-based consultation are key to implementation. Question 63. Upon evaluation of the client's plan of care, the nurse determines that the expected outcomes have been achieved. Based upon this response, the nurse will do what? A. Terminate the plan of care. B. Modify the plan of care. C. Continue the plan of care. D. Re-evaluate the plan of care. The correct answer is terminate the plan of care. If goals are met, the specific plan for that problem can be terminated. Question 64. Which activity does the nurse engage in during evaluation? Select all that apply. A. Collect data to determine whether desired outcomes are met. B. Assess the effectiveness of planned strategies. C. Adjust the time frame to achieve the desired outcomes. D. Involve the client's family in formulating desired outcomes. The correct answer is collect data to determine whether desired outcomes are met, and assess the effectiveness of planned strategies, and adjust the time frame to achieve the desired outcomes. Evaluation involves checking if goals were met and adjusting the plan. Question 65. An expected client outcome is free of infection. The client has high WBC and wound discharge. Which statement is appropriate? A. Goal partially met. Client identified fever and presence of wound discharge. B. Client understands the signs and symptoms of infection. C. Goal partially met. Client able to perform activities of daily living. D. Goal not met. White blood cell count elevated. Presence of yellow-green discharge from wound. The correct answer is goal not met, white blood cell count elevated, presence of yellow-green discharge from wound. Evidence shows infection is still present, so the goal is not met. Question 66. The mother of a toddler with asthma seeks support from the parents of other children with asthma. The nurse recognizes that seeking and utilizing support systems is an example of which human dimension? A. A physical dimension. B. Environmental dimension. C. Sociocultural dimension. D. Intellectual and spiritual dimension. The correct answer is sociocultural dimension. Support systems fall under the sociocultural dimension. Question 67. An elderly woman has total care of her husband. What type of care might the nurse suggest to help the couple? A. A primary care. B. A respite care. C. A bereavement care. D. Palliative care. The correct answer is respite care. Respite care provides temporary relief for primary caregivers. Question 68. Which of the following responses would be appropriate for safety for a 14-month-old daughter? Select all that apply. A. Keep medications locked away. B. Keep plastic bags out of reach. C. Use approved age car seats. D. Teach to chew small food well. E. Do not swing by arms or legs. The correct answer is keep medications locked away and keep plastic bags out of reach and use approved age car seats. Safety involves poison control, suffocation prevention, car safety, and injury prevention. Question 69. Which of the following clients is at an increased risk for oral problems? Select all that apply. A. A comatose client. B. Confused client. C. Depressed client. D. Uninsured client. E. Hypertensive client. The correct answer is comatose client and confused client and depressed client and uninsured client. Hypertensive client. Inability to perform self-care or lack of access increases oral hygiene risk. Question 70. What care would the nurse recommend to the family of a client who is diabetic, regarding foot care? Select all that apply. A. Cut the toenails very short. B. Cut the left and right nail corners. C. Avoid cutting into calluses. D. Cut the nails straight across. E. Use plenty of lotion on the feet and toes. The correct answer is avoid cutting into calluses and cut the nails straight across. E. Use plenty of lotion on the feet and toes. Diabetic foot care requires careful trimming, straight across, and avoiding injury, calluses. Question 71. Which of the following clients would be considered at risk for skin alterations? Select all that apply. A. A teenager with multiple body piercings. B. A homosexual in a monogamous relationship. C. A client receiving radiation therapy. D. A client undergoing cardiac monitoring. E. A client with diabetes. The correct answer is a teenager with multiple body piercings and a client receiving radiation therapy. Piercings, radiation, and diabetes, poor healing/sensation, increase skin risk. Question 72. A nurse is applying cold therapy. Which of the following is an effective therapy? Select all that apply. A. Reduces muscle spasms. B. Increases blood flow to tissues. C. Constricts peripheral blood vessels. D. Reduces the formation of edema and inflammation. E. Increases release of pain-producing substances. The correct answer is reduces muscle spasms and constricts peripheral blood vessels and reduces the formation of edema and inflammation. E. Increases release of pain-producing substances. Cold constricts vessels, reduces edema, and relieves spasms. Question 73. Which of the following are functions of the skin? Select all that apply. A. Sensation. B. A protection. C. A temperature regulation. D. Immunological. The correct answer is sensation and protection and temperature regulation and immunological. The skin performs all these protective and regulatory functions. Question 74. A client has insomnia. What questions should the nurse include in an assessment? Select all that apply. A. Do you smoke? B. Do you have a family history of sleep disturbances? C. What medications are you currently taking? D. How would you characterize your mood lately? E. Routine around getting ready for bed? The correct answer is do you smoke? And what medications are you currently taking? And how would you characterize your mood lately? Routine around getting ready for bed, smoking, meds, mood, and routine affect sleep hygiene. Question 75. The client is newly diagnosed as having a terminal disease and asks, "I'm going to die soon, aren't I?" What would be appropriate replies of the nurse? Select all that apply. A. Tell me how you feel. B. No, you are not actively dying. C. This is something I am not comfortable discussing. D. What have you been told by your healthcare provider? The correct answer is tell me how you feel. And what have you been told by your healthcare provider? Open ended therapeutic communication invites feelings and assesses understanding. Question 76. The client describes his inability to be intimate with his wife. Which of the following would be a priority for the nurse to assess? Select all that apply. A. Sleep quality. B. A medication prescribed. C. Level of stress at work. D. Social activity. E. Specifics about sexual problem. The correct answer is sleep quality and medication prescribed in level of stress at work. Meds, stress, sleep, and the specific problem are relevant to sexual dysfunction. Question 77. As the nurse is giving the client her morning medications, she begins a conversation about her belief in a higher power. The nurse knows that this can be interpreted as which of the following? Select all that apply. A. God. B. Faith. C. Religion. D. Atheism. E. Is spirituality. The correct answer is God and faith and religion. Belief in a higher power relates to spirituality, faith, religion, and God. Question 78. A nurse uses informatics to plan nursing care for a client. Which three terms best describes this science as it is applied to nursing? A. Process, documentation, analysis, reporting. B. Data, information, knowledge, wisdom. C. Research, data, controls, variables. D. Hypothesis, nursing, practice, evaluation. The correct answer is data, information, knowledge, wisdom. DIKW, data, information, knowledge, wisdom, is the core framework of informatics. Question 79. The nurse managers wish to maximize nurses' freedom to characterize and record client conditions in the nurse's own terms. Which documentation format promotes this? A. Narrative notes. B. Collaborative charting. C. Charting by exception. D. Paraphrasing documentation. The correct answer is narrative notes. Narrative notes allow for free text description. Question 80. A nurse is admitting a client to a geriatric medicine unit. Which of the following nursing actions is most likely to reduce the client's chance of experiencing a fall? A. Place the client in a shared room with a client who is stable and oriented. B. Orient the client to the room and environment thoroughly upon admission. C. Provide the client with a bedpan to reduce the need to transfer to a commode or washroom. D. Administer pain medications sparingly in order to minimize cognitive or musculoskeletal side effects. The correct answer is orient the client to the room and environment thoroughly upon admission. Orientation reduces confusion and risk of injury in new environments. Question 81. Nurses provide many interventions to prevent falls. Which of the following would be an appropriate intervention? Select all that apply. A. Keep bed in the high position. B. Keep all side rails up at all times. C. Apply restraints to all confused clients. D. Lock wheels on beds and wheelchairs. E. Clear pathway from patient's bed to bathroom. The correct answer is lock wheels on beds and wheelchairs. E. Clear pathway from patient's bed to bathroom. Locking wheels and clearing pathways are standard fall prevention measures. Question 82. A client's bed partner reports the client often has irregular snoring and silence followed by a snort. Does this warrant further assessment? A. No, snoring has varied patterns. B. Yes, the bed partner is unable to sleep at night. C. No, this is a description of normal snoring. D. Yes, this is an indicator of obstruction apnea. The correct answer is yes, this is an indicator of obstruction apnea. This pattern is characteristic of obstructive sleep apnea. Question 83. A client scheduled for complex heart surgery has been reading the Bible for hours each day, cries often, and is not sleeping well. What might these observations cue the nurse about the client? A. These behaviors are expected before major surgery. B. Family members live far away and the client is lonely. C. These behaviors are signs of spiritual distress. D. The client is naturally emotional and reactive. The correct answer is these behaviors are signs of spiritual distress. These are potential indicators of spiritual distress/anxiety. Question 84. A nurse is responding to sexual harassment from a client at work. Which of the following is a recommended guideline for dealing with this behavior? A. Do not confront the person harassing you in person. B. Set and enforce limits to the behavior and maintain boundaries. C. If confronted by management, deny any feelings about being harassed. D. Document the incident but do not report it to the supervisor unless harassment continues. The correct answer is set and enforce limits to the behavior and maintain boundaries. Setting firm limits is the first professional response to harassment. Question 85. Surface temperature measurement is expected to be higher than core temperature. A. True. B. False. The correct answer is false. Core temperature is higher than surface temperature. Question 86. The center of control of temperature in one's body is the pituitary gland. A. True. B. False. The correct answer is false. The hypothalamus controls body temperature. Question 87. Transfer of heat from a warm to a cool surface by direct contact is called what? A. Conduction. B. Convection. C. Radiation. D. Evaporation. The correct answer is conduction. Conduction is heat transfer via direct contact. Question 88. Core temperature below normal, less than 95 F or 35 C, is known as what? A. Hyperthermia. B. Fever. C. Hypothermia. D. Pyrexia. The correct answer is hypothermia. Hypothermia is defined as core temp 95 F. Question 89. The ___ pulse is considered to be the most reliable reading of heart rate and should be auscultated for 1 full minute. A. Radial. B. Brachial. C. Apical. D. Carotid. The correct answer is apical. The apical pulse is the most reliable central pulse site. Question 90. The time of infection until manifestation of symptoms, a likely time to infect others, is defined as the ____ stage. A. Prodromal. B. Convalescence. C. Incubation. D. Acute. The correct answer is incubation. Incubation is the period between exposure and symptom onset. Question 91. A state of cleanliness that decreases the potential for the spread of infections is called asepsis. A. Surgical. B. Medical. C. Sterile. D. Complete. The correct answer is medical. Medical asepsis, clean technique, reduces the number of pathogens. Question 92. The importance of standardized language when documenting in healthcare is meant to A. Challenge nursing research. B. Increase the risk of fragmentation in reporting. C. Provide standardized terminology to use in errors. D. Makes the profession of nursing invisible. The correct answer is provide standardized terminology to use in errors. Standardized language ensures consistency in electronic health records. Question 93. Which of the following are functions of the skin? Select all that apply. A. Protection. B. A sensation. C. Immunological. D. Temperature regulation. E. A vitamin C production. The correct answer is protection and sensation and immunological and temperature regulation. E. A vitamin C production. Skin protects, senses, regulates temp, and has immune functions. Question 94. Which of the following are recommended guidelines for pain management? Select all that apply. A. Teach all clients to use a pain rating scale. B. To determine a pain rating goal with each client. C. Use pharmacologic pain relief measures first. D. Manipulate factors that affect the pain experience. The correct answer is teach all clients to use a pain rating scale, and determine a pain rating goal with each client, and manipulate factors that affect the pain experience. Assessment and non-pharmacologic manipulation are key. Drugs aren't always first. Question 95. Which of the following are conditions that must be met for a person to receive the necessary data to experience the world? Select all that apply. A. A stimulus must be present. B. A receptor or sense organ must receive the stimulus. C. The nerve impulse must be conducted along a nervous pathway. D. A particular area in the brain must receive and translate the impulse. The correct answer is a stimulus must be present, and a receptor or sense organ must receive the stimulus, and the nerve impulse must be conducted along a nervous pathway, and a particular area in the brain must receive and translate the impulse. Sensation requires stimulus, receptor, pathway, and brain translation. Question 96. The nurse performs which of the following interventions to assist the client in adapting to hearing loss? Select all that apply. A. Make sure he wears his hearing aid. B. Speak in a lower tone of voice. C. Speak so he can observe your lip motions. D. Keep his environment clear of clutter. The correct answer is make sure he wears his hearing aid, and speak in a lower tone of voice, and speak so he can observe your lip motions. Lower tones are heard better. Lip reading and hearing aids assist communication. Question 97. Which of the following abbreviations is on the list of the Joint Commission do not use abbreviations? Select all that apply. A. U, unit. B. QD, daily. C. NPO, nothing per OS. D. ml, milliliters. E. GT, greater than. The correct answer is U, unit, and QD, daily. U, QD, and GT are on the do not use list due to error risk. Question 98. Which of the following are examples of incidental disclosures of client health information that are permitted? Select all that apply. A. A nurse working in a physician's office puts out a sign-in sheet. B. Two nurses are overheard talking about a client through the door. C. The nurse places a client chart in a holder. D. The nurse calls out the name of a client who is seated in the waiting room. The correct answer is a nurse working in a physician's office puts out a sign-in sheet, and two nurses are overheard talking about a client through the door, and a nurse calls out the name of a client who is seated in the waiting room. Sign-in sheets and muffled conversations are often considered incidental. Question 99. Which of the following are examples of breaches of client confidentiality? Select all that apply. A. A nurse discusses a client with a coworker in the elevator. B. The nurse shares her computer password with a relative of a client. C. A nurse checks the medical record of a client. D. A nurse updates the employer of a client regarding the client's return to work. The correct answer is a nurse discusses a client with a coworker in the elevator. And a nurse shares her computer password with a relative of a client. And a nurse updates the employer of a client regarding the client's return to work. Public discussion, password sharing, and unauthorized updates are breaches. Question 100. In which of the following cases should a progress note be written? Select all that apply. A. For any nurse-client interaction. B. When admitting a client. C. When receiving a client postoperatively. D. When assisting a client with ADLS. E. When a procedure is performed. The correct answer is when admitting a client, and when receiving a client postoperatively. Progress notes are needed for significant events like admission, postop, and procedures. Question 101. Which of the following are classes of nutrients that supply energy? Select all that apply. A. Of vitamins. B. Protein. C. Fats. D. Minerals. E. Carbohydrates. The correct answer is proteins and fats. Proteins, fats, and carbs provide calories, energy. Question 102. Which of the following factors increase BMR? Select all that apply. A. Growth. B. Infection. C. A fever. D. Emotional tension. The correct answer is growth and infection and fever and emotional tension. All listed factors stimulate metabolism and increase BMR. Question 103. What should the nurse do when physically assessing the quality of the client's oxygenation? Select all that apply. A. Monitor the client's respiratory rate. B. Note the amount of oxygen administered. C. Check the symmetry of the client's chest. D. Observe the breathing pattern and effort. The correct answer is monitor the client's respiratory rate, and check the symmetry of the client's chest, and observe the breathing pattern and effort. Rate, symmetry, and effort are physical assessment findings. Question 104. Potential causes of poor self-concept at age 13 can be related to which of the following? Select all that apply. A. Inability to accept bodily changes. B. Identity confusion. C. A failure to accept role responsibility. D. A failure to develop meaningful goals. E. Inability to resolve child versus adult roles. The correct answer is inability to accept bodily changes and identity confusion. Adolescents struggle with body image, identity, and role transition. Question 105. Client asks, why would something so positive cause stress? Which is an appropriate response? Select all that apply. A. All major life events can cause stress for us. B. People vary greatly in their perception of what constitutes as a crisis or stressor. C. Your job promotion probably has nothing to do with the stress you feel. D. Positive life events do not cause stress or illness. E. Even positive life events can affect us in negative ways. The correct answer is all major life events can cause stress for us, and people vary greatly in their perception of what constitutes as a crisis or stressor. Eustress, positive stress, still impacts the body and mind. Question 106. In general, which of the following does society emphasize and reward regarding aging? Select all that apply. A. Wisdom and sharing. B. Youthfulness. C. Mentoring the inexperienced. D. Health and fitness. E. Physical attractiveness. The correct answer is youthfulness and health and fitness. E. Physical attractiveness. Western society often values youth, fitness, and beauty over wisdom. Question 107. Which of the following focuses will give the nurse the most information about the client's self-concept? Select all that apply. A. Body image. B. Gender identity. C. Self-esteem. D. Role performance. The correct answer is body image and self-esteem and role performance. Body image, self-esteem, and role performance are core components of self-concept. Question 108. You are working on a burn unit and one of your acutely ill patients is exhibiting signs and symptoms of third spacing. Based on this change in status, you should expect the patient to exhibit signs and symptoms of what imbalance? A. Metabolic alkalosis. B. Hypermagnesemia. C. Hypercalcemia. D. Hypovolemia. The correct answer is hypovolemia. Third spacing moves fluid out of vessels, causing hypovolemia. Question 109. Which of the following serum creatinine values would suggest to the nurse that a patient has compromised renal function? A 1.8 mg/dl, 18 mg/dlc, 1.018 d, 18 milliequivalent/L. The correct answer is 1.8 mg/dl. Normal creatinine is approximate 0.6 to 1.2, 1.8 indicates impairment. Question 110. A patient with hypoparathyroidism complains of numbness and tingling in the fingers and around the mouth. The nurse would assess for what electrolyte imbalance? A. Hyponatremia, B. Hypocalcemia, C. Hyperkalemia, D. Hypermagnesemia. The correct answer is hypocalcemia. Hypoparathyroidism leads to low calcium, causing paresthesias. Question 111. The nurse is caring for a client with heart failure. The nurse suspects excess fluid volume. What additional signs would the nurse expect to note? A. Weight loss, B. Increased blood pressure, C. Flat neck veins, D. Increased bun. The correct answer is increased blood pressure. Fluid overload increases vascular volume, raising BP. Question 112. A patient with hyperkalemia is at greatest risk to develop which of the following? A. Cardiac dysrhythmias, B. Renal failure, C. Tetany, D. Laryngospasm. The correct answer is cardiac dysrhythmias. High potassium critically impacts cardiac conduction. Question 113. A nurse is reading a physician's progress notes that the physician has documented insensible fluid loss. This type of fluid loss can occur through A. Wound drainage, B. The skin, C. Urinary output, D. The GI tract. The correct answer is the skin. Insensible loss occurs via skin, sweat, and lungs. Question 114. The client is admitted with a serum sodium level of 100 milliequivalent/L. What is the priority nursing intervention? A. Encourage fluids orally, B. Administer a 10% dextrose solution, C. Initiate seizure precautions, D. Notify the physician. The correct answer is initiate seizure precautions. Severe hyponatremia, 100, carries a high risk of seizures and cerebral edema. Question 115. Which of the following is considered a hypotonic 4 solution? A. Lactate Ringer's solution, B. 5% dextrose/water, C. 0.25% NSSD, 5% dextrose/NSS. The correct answer is 0.25% NSS. 0.25%, quarter normal, saline is hypotonic. Question 116. Which of the following is considered an isotonic 4 solution? A. 5% dextrose/0.45% NSSB is 0.9% NSSC is 0.45% NSSD, 3% NSS. The correct answer is 0.9% NSS. 0.9% normal saline is the standard isotonic solution. Question 117. The nurse is caring for a client suspected of having renal dysfunction. When reviewing laboratory results, the nurse interprets the presence of which substances in the urine as the most suggestive of pathology? A. Potassium and sodium, B. Bicarbonate and urea, C. Glucose and protein, D. Creatinine and chloride. The correct answer is glucose and protein. Protein and glucose are not normally present in urine. Question 118. The nurse is caring for a client who describes changes in his voiding patterns. Feel the urge, empty the bladder, there doesn't seem to be much urine flow. What would the nurse expect this client's physical assessment to reveal? A. Hematuria, B. Urinary retention, C. Dehydration, D. Kidney injury. The correct answer is urinary retention. Frequency with small amounts is a classic sign of retention, overflow. Question 119. The nurse is caring for a client with a nursing diagnosis of deficient fluid volume. The nurse should recognize that the client's kidneys will compensate by secreting what substance? A. Antidiuretic hormone, ADH, B. Aldosterone, C. Or renin, D. Angiotensin. The correct answer is antidiuretic hormone, ADH. While kidneys secrete renin, the provided answer key indicates ADH, which conserves water. Question 120. A patient is admitted for treatment of glomerulonephritis. On initial assessment, the nurse detects one of the classic signs of acute glomerulonephritis of sudden onset. Such signs include A. A green-tinged urine, B. Moderate to severe hypotension, C. Polyuria, D. Periorbital edema. The correct answer is periorbital edema. Periorbital edema is a classic sign of glomerulonephritis. Question 121. A patient is diagnosed with pyelonephritis. Which nursing action is a priority for care now? A. Monitor hemoglobin levels, B. Ensure sufficient hydration, C. Insert a urinary catheter, D. Stress the importance of the use of long-term antibiotics. The correct answer is ensure sufficient hydration. Hydration helps flush bacteria from the urinary tract. Question 122. A patient with history of chronic renal failure receives hemodialysis treatments through an arteriovenous AV fistula. Which intervention should the nurse include in the care plan? A. Keep the AV fistula site dry, B. Keep the AV fistula wrapped in gauze, C. Take the client's blood pressure in the left arm. D. Assess the AV fistula for a bruit and a thrill. The correct answer is assess the AV fistula for a bruit and a thrill. Assessing for bruit and thrill confirms fistula patency. Question 123. While teaching a patient with chronic renal failure to perform daily peritoneal dialysis, catheter care with instruction would be important to emphasize? A. Be sure to empty the bladder before each treatment. B. Change the dressing weekly. C. Examine the site for signs of infection while cleaning the area. D. Pull on the catheter and hold taut while cleaning the skin. The correct answer is examine the site for signs of infection while cleaning the area. Infection is a major risk in PD, checking the site is crucial.